Hello, good morning, good afternoon, good evening, everyone, wherever you are. And welcome to today's webinar, HIPAA Compliance 2.0. Is your identity security strategy ready? My name is Bob Lapsley, and I'll be your moderator today. We have an excellent presentation for you. Our hosts are Roy Ackerman, VP of Identity Security Strategy here at Silverfort, and Steve Moore, Chief Security Strategist at Exabeam. Just a few housekeeping notes before we jump in. Your microphones will remain muted during the session, and our speakers will be the only ones visible on camera. But we do encourage you to ask questions. You can submit them anytime using the Q&A feature, and we'll address as many as possible during the Q&A session at the end. If we're unable to get to your question during the presentation, we'll follow up after the session with your answers via email. Today's session is being recorded, and you'll receive a copy of the recording after the event. So I think that's pretty much it. Like I said, we have a fantastic session, and without further ado, let's get started. Over to you, Roy.
Thank you, Bob, and hey everyone, and welcome to a webinar on the HIPAA compliance updates. We have a full agenda for today, and I'm happy to host this with my friend Steve, that was taking roles both from the strategic area and the practitioner level as well. So we'll try to spice it up with not just like going through the major offer changes that we have in the framework, and this is maybe the most important part to emphasize on. The organization is suggesting right now the changes themselves. It was open to the public comments until the 7th of March, and now they're processing most of the data, and it will probably get out around Q3, Q4. We don't really know when. But we have a jam-packed agenda for today, and whether you're a CISO, a security practitioner from the GRC area, from the auditing, or a security engineer that is about to get asked to implement all of those changes, this webinar is for you. And at the beginning, we'll actually give a little bit of sense of why do these HIPAA changes matter and why they matter now. Of course, we had a Presidential Act, we have soaring attacks coming in, but what is it that leads to those changes? We'll then give you the highlights or the major parts of the proposed update, and we'll give our own interpretation or our own spice and flavor about what opportunity it gives to you guys in order to promote your security agenda. It's important to say that Steve and I commented to the proposed changes as well. We'll speak about that as well. We'll give another sense or another angle, not just from the auditor side or the regulator side, but also from the attacker's side, right? Because once those changes are public, we know that attackers will focus on those weak points until you'll fix them. And we'll give a few examples about the cost and about how these things are usually goes, and even suggest on to play the IR game. And by the end of the day, we'll speak about the key steps for you guys in order to strategically implement or address those changes. As Bob said, feel free to use the chat. Be very vocal there, ask questions, push back. That's what we're here for. And with that, let's continue. So, Steve, I mean, we've discussed that a lot, and the updates are not official yet. And yet we've decided that this is the right time to go and speak about those major changes. Maybe before starting, why do you think that those changes matter now, specifically now?
Yeah, there's a couple different reasons, at least that I believe. First off, as the slide indicates, adversary activity and success. I think we've seen, no one needs to be reminded of the success, especially of criminal groups around ransomware, especially within both payers and providers. So that's sort of the first thing. And the next is this really hasn't been updated in a long while. So there's a bit of catch up. Most of what I see in the document is good, is positive. I'm happy to see it. But I'll even kind of temper that a little bit by saying that a lot of it I don't think is enough. It's a good catch up, but I think we need to push on some areas, which we'll cover later. And then the other, and this is a lot of extra work for people. There's many states rules that have come into place that have tried to kind of put in and make a stopgap for these, which is well-meaning and good, but it ends up being this sort of extra cumbersome thing to address. It was, back when I used to run and build security operations centers and do incident response work. It's amazing how much of your analytic time is sort of borrowed by compliance and managing this sort of patchwork of needs. You're always having an audit, and so I think they're looking to sort of unify via this update. And so it's those three levels, and I'm glad to see it. I want them to push a little harder in a couple areas, which you mentioned, which is why we actually gave feedback in the comment period. Uh, as you mentioned again, it's not yet been ratified, but I expect most of it will be. And so the goal here is to talk about it all very early, sooner than later.
Yeah. Yeah, thank you for that. And let's jump into the changes that we're seeing or the offered updates. Just in short, as we've mentioned, this is in the review period. But once the regulation hits, once it's being published, there's a strict timeline. And maybe it's very important to say, although most of us know, because HIPAA consists of three key rules: privacy, security, and breach rule. We know that by the end of the day, those regulations, are imposed by hefty fines and covering areas of reputational damage as well. So that we'll need to implement and adhere our systems in order to meet those regulations pretty soon, right, Steve? It's not just let's start to prepare once they're published. We need to be ready to implement. There's a strict timeline.
Yeah, I think the organizations, if you're sort of watching this and interested, you need to begin thinking about what these swim lanes might be, and how this modifies the goals you have for the next year. Because as the chart says, I mean, it's 180 days will fly by. And again, we don't know when they'll be approved, but if you have a general idea of the areas that are going to be affected, you can begin sort of putting together the justification and scoping the work, especially for organizations like hospitals that often don't have a lot of extra IT and IT security help. You may need to justify even some outside help to sort of work on these problems. And so getting an early start and then socializing it internally, sharing it with your leadership. If you're on this call, like you probably already know and you've probably already socialized it, but maybe not. Maybe it's time to begin thinking about it, just to get ahead of it, because it will be a mountain of work.
Yeah, and we'll be very happy to help you to start thinking about that and planning. So from that, let's dive in a little bit to what's actually we've seen in the proposed document, which was like almost 400 pages, with explanations and with deep dives to new areas that we didn't see in the last version that, Steve, correct me if I'm wrong, was published around 2013, right?
I think so, yeah.
So yeah, way long to go and a lot of updates over there. And again, just giving you a little bit background, although you probably know that as well. HIPAA stands for the Health Insurance Portability and Accountability Act. And the idea is to safeguard across three different rules: privacy, security, and breach. And in this updates, we're seeing the first mentioning of mandatory MFA, or basically how we like to say MFA everywhere, especially around your sensitive data, or EPHI. And let's deep dive a little bit to that area. We know that MFA is a very prevalent security control, but we already know that there's wrong and right ways to implement MFA controls around your services, around your data, around your remote access, internal and external users. Steve, you've implemented that many, many times and spoke with customers that were under attack as well when they didn't implement that right. Let's try to give our audience a little bit of depth to that requirement and interpretation from our side.
Yeah. So the benefit of requiring this is it's more of a inside requirement than just an outside in. Let me explain what I mean. So in many cases, we think of MFA as I have remote access and I need to gain access, and I have an edge requirement. I have a VPN, I have a cloud service. This extends to sort of inside the network. So whatever systems they may have once you're inside the hospital or inside whatever it be, an insurance company or whatever it may be. So that's a very positive thing. Now, the way they've scoped it is that the way it reads here is that it's EPHI. What I'll extend is that it's also systems that support sort of the CIA triad of that, right? So the availability, integrity, confidentiality, it's supporting. So things like the core authenticator, any sort of points of federation. So the definition is a little bit wider than you might think. So that's all very positive. What it doesn't go in and do, kind of in two key areas, and where we often see failures, either underconfigured or misconfigured, weak technical or weak administrative controls lead to all sorts of failures in this space. Whether it's a weak help desk, challenge and response, we've seen that allows for sort of the reset of credentials, or not expanding it enough to include the types of accounts that assist an adversary once they're in a network. So even if you lock up your outside, if a persistence mechanism is found, things that might limit behavior around lateral movement or the misuse of things like service accounts or difficult to secure environments like SMB shares or old legacy systems that don't allow for MFA, right? These are sort of the soft points. And so while I appreciate the definition and I even like the expanded scope to include supporting systems, it needs to get way more aggressive and start looking into things like account fencing and, in order to limit misuse, prevent lateral movement, and allow you to kind of do this kind of step up authentication for everything. But the core of it is good. I'm glad to see it. But that's my maybe extended view of what they have offered and my critique of it.
Yeah, so I totally agree with the why. We need to remember that it's to stop lateral movement, account takeovers, and misuse. And when we're starting to implement the what should we MFA? As first and foremost, it's privileged identities, but we shouldn't forget a lot of type of users that we have, a lot of types of services that we have, external, internal, consultants, partners. We know that in healthcare, it's pretty complex, right? It's not one unified system. It's comprised for so many different OT, IT, and interfaces. So we need to remember that. And Steve, what you just said resonates to me. It's not just implementing the security control, it's getting it work in a smarter way for you, right? For example, it's not just to MFA a user, it's to remember that we're validating not just the who is trying to do something, but also what happened to that person or machine before they started to authenticate, right? And what they're trying to do. And if this abnormal or normal activities, what do we expect? This is the last point of validation we can make. And we need our MFA to be dynamic. We need our MFA to be behavioral aware, to be context aware. And we're encouraging, like our audience here to take this opportunity and implement MFA right, because there's way to bypass MFA with bombing and others. So I think we spoke for MFA, enough for that session. Let's move to the second one, Steve. I'll hand the baton for you.
Yeah, so incident response, hopefully it's something that, an organization wouldn't have to do a lot of, but they want to plan and they want to see it tested. And that's the net of it. There's also requirements around reporting, but setting that aside, I would like to see more than just an annual test. Typically a document that's created in kind of, you'll hear me often talk about things that are built within a vacuum of experience, often are of little value, meaning don't create a document here that is just good for the pending audit that you're about to have and sort of looks good to an auditor. Make sure that it represents the actual tasks that you're likely to take if there's a problem, that covers things like escalation and executive communication, customer communication. So if you have, think of who are your customers. It's your supply chain, it's your subsidiaries, and it's your patients in this example if you're a hospital. But there's a lot of other organizations that you interact with. And so thinking that how will you manage that? How will you create content around that? And how will you do so in a way that's repeatable and doesn't sort of put you in a helpless state? I see this all over as somebody who's done a fair amount of breach response, both in criminal and espionage kind of situations. People have a plan and they never use it because it's not worth anything. And so I would implore you, don't create these incident plans in a vacuum. Go talk to your people who actually monitor these environments and then try to figure out how to create these and have it be a living document. It should be something that's updated frequently and tested more than once a year.
Yeah, and we all appreciate that when once we're getting hit, right, we have this script just ready to play. And identity played such an important role in incident response. So again, making sure that we're ready from all aspects. The third one is I think it's an elusive, obvious one, right? Like from the one hand, we're maintaining a list, and we'll speak about inventory for a second, of every system, every process that we have, what the damages, the expected damages will be. We're prioritizing, we're preparing for switching gears between like the day-to-day to an emergency or an urgency that's coming up. Steve, there are a lot of models to run risk analysis, and you saw this in healthcare and in other businesses as well. What can you tell to our audience that will help them to take the first step or to enhance what they already have?
Yeah, so this is probably going to be new to many organizations, and the risk analysis and the asset inventory are kind of linked. The goal here is to go through and to list out the perceived and real risks to the organization and sort of to weight it on frequency and impact. It's pretty high level what they outline in the document, but the idea is that you've done sort of the planning around your environment, beginning with an asset inventory. And I'll tell you that it sounds well and good to say this, but most organizations I interact with, and I interact with a lot, very large organizations, you would be amazed at how many CISOs can't tell you for sure how many assets they have. Meaning, and it gets even worse when you get into things like knowing a network diagram or knowing even how many credentials you have and how many non-human identities you have. It just scales to a point. And so it's cute to see asset inventory on there, but it's a very big lift. But it's meant to be an exercise where the security team then has something that they can reference that then is the starting point of future effort and cleanup. Ideally, then over time, you show how that risk analysis changes as these are done yearly and updated. So they need to be a trigger for work. And the piece of advice I have with these, the goal, just like with, you hear me talk about pen testing, which is in the future, the goal should be to look ugly, not to look pretty. Don't cause extra harm to yourself, but use it as an incentive and justification to get your work done. It's over time, it's okay to look a little better, but look ugly early is my advice. And then I already kind of covered the asset inventory. Um, that's again a difficult one.
Yeah, look ugly. I'll remember that.
Yeah.
Sure. And yeah, the complexity is sometimes huge. I remember that as a national advisor, when we mapped risks at hospitals, we found in the inventory level more than 300 systems, disconnected systems that you need to protect, and each of one have their own risk and their own story. We have a little bit of time to speak about that later as well. Of course, there's other chapters that being mentioned there. And there are some critiques around that, but they're good to have and to start to establish the implementation on them as well. We have encryption, again, all data, all PHI at rest and in transit. Again, Steve, if you can speak a little bit about the complexity here and how should we prep, what should we expect to see when trying to impose this on our IT or partners or others?
Yeah, I'm going to hit probably my favorite and then my least favorite, and then we can move forward because we're not going to cover a lot of this extra. But the scheduled checkpoints that are shown below, again, if you do pen testing, I mentioned earlier about being ugly. If it doesn't involve endpoint exploitation and the theft of credentials and misuse as part of the test, it's not a valid test. If it's not looking to gain access to a system and leading to and using these theft and compromise of a credential for purposes of in a limited at least attack chain, then you're sort of wasting your time. And so focus on that. Let those failures allow you to sort of bolster and give evidence that you need to improve. And the other thing is, this is very controversial. I even hesitate to say it, but encryption is well-meaning, but largely expensive and kind of a waste of time, right? You have a data center and you have to encrypt. In many cases, it's only good if you have a problem with stolen hard drives, which you might. Hopefully you don't. But generally, from an access level, kind of the layer 7 and above, any credential that you steal is going to unlock any data that's sort of human viewable that results in theft, right? So it's well-meaning. I don't know that it's bad, but I would rate it. It's kind of the least valuable of any of this stuff. If I were going to kind of put a weighted back to that risk assessment that we mentioned earlier, right? If I was going to put an impact score on the value of encryption outside of like SSL certs and these sorts of things, I would pass and minimize that effort, or at least make it kind of the long tail of effort anyway.
Well, yeah, let's see what the requirements will, end up to be. But I again agree. I saw many attacks that just, finding the weak spot, like getting the key, piggy bank the session, and getting access to whatever they want. And yet this is a requirement. So I think that this is the right time to dive in a little bit to some of the requirements in depth. We already started with mandatory MFA. Maybe let's give a few just points of implementation, what to look at, and speak about real scenarios or real attacks that happens, and how the right implementation of MFA will actually stop that. So we all know what's MFA about, and the big question is what to consider for a more modern and hybrid environment, right? Like cloudified environment, an environment that we have more than human users over there, a lot of machine identities as well. That, by the way, it's one of our submissions for changes in the comments were that service accounts or non-human accounts are not getting enough focus or enough attention in the updates, and I hope that this will be changed. But back to MFA, one of the most important things is to make sure that we're maintaining not only assets inventory, but identities inventories and entitlements inventories. And that around those two, like A to B, right, like identity to an asset flow, we're wrapping the right security controls in the right way. Not that easy when you have so many types of users and a lot of privileged users around your hundreds of systems, right? But the most important thing is to maintain that inventory and then to wrap it with the right security controls. Steve, I already spoke about the risk-based approach or the dynamic approach. Can you give a practical advice about how to implement that?
Yeah, there's a couple different ways to think of it, but maybe the simplest, maybe it's the most difficult, but I would want to go through, if I wanted an asset inventory, think of all the things that you know that you're going to need to protect, and you have not been able to do so due to some limitation, right? So there's lots of systems that support the operations within a hospital or an insurance company. Many of those are things like file shares or legacy tech. You mentioned 300 pieces of technology. It's not uncommon to see that or more. And many of those are either out of date, not supported, and they're very difficult to sort of manage access to, whether that's supporting within the life cycle, but then also sort of protecting what that is. And so when you have situations like that, begin your assessment of creating that list of what do I need to protect that's not protectable, and begin thinking about that of, well, then how might I do that, and what's the operational impact? So how do I identify, how do I provision, and then how do I educate my users on this? So that's kind of one of the steps. That's sort of from a business perspective, right? So what are people using that we have access to? The next is trying to figure out a way to break up sort of your tiers of access within privilege, right? You have tier 0, which is sort of the domain admin, which is typically half of 1%. Sometimes it's as high as 1%. But what are those accounts? And what additional protections do I want to have within that? So things like just-in-time protection, where you have credentials that are effectively inert and won't do anything until they're sort of checked out and used, and then they have the ability, ideally, to sort of time out. So there's a mechanism to actually kill that session and the access associated with it. But tier 0, tier 1, and kind of tier 2. Tier 1 being your general admins. And then you kind of have things like help desk and others. And then you have sort of the general population beyond that sometimes have, nested administrative rights, and that can get kind of messy. So what are the systems I need to address? And then something to help you take inventory of all these accounts and kind of put them in a category. I think that's what I would, at the highest of levels, how we want to think of it. And then the third is, this is more philosophical, but we're seeing organizations that are, identity kind of used to be years ago. You would provision an account and then you might add an entitlement to it, and then that person leaves or changes jobs and you disable the account. Leading organizations now have to think of this differently because of this sort of unification of analytic work and sort of security operations center work and identity, where these credentials need to be monitored, and they're a living thing and they need addressed sometimes daily based on their behavior. And so philosophically, think of the identity group as an analytic team, not just a provisioning team. Whether that's just one person or a half of one person, that's sort of table stakes now. So just unpack MFA and to think philosophically of all these items that get into expanded definition, but also philosophically what it requires and what does that mean to your career? Because to me, it sounds a lot more interesting and exciting to be thinking about how an adversary might use a credential and the behavior of it and how to lock it down and how to do, kind of these, the term kind of going around of these identity firewalls, and how do I leverage these practices in my environment to make it more resistant and disrupt and break the cycle of compromise?
It resonates with me, and this is a really serious subject, but we can have fun and get innovative and creative, right? Like we can imagine that, okay, like that's audit day, let's see what we've completed and what's not, what the issue will be, or to like imagine that we're in a game that we need to win and get ahead of the attackers, right? And then MFA beyond the checkbox gets another flavor of slowing down attackers that maybe had a first step in our system, and then reducing the risk around all the other privileged or sensitive systems. And it's important to say that here that we have a relationship between IAM people or security engineers that will implement these security controls. And from the other way around, we have the relationship when we spoke about IR with threat detection and response teams, with managed detection and response, and with others. And MFA is a central point of validation that can serve both, right? For response or for protection and prevention. So when we'll, sitting down and planning, we need to take all of those dynamics into account. And if we'll dive into the numbers a little bit of how important that, and we'll just get into a first case study, a story the statistics first, and then a case study. So we can see that between 2018 and 2023, the affected individuals, right, in the central or like middle column, like of cyber attacks, expanded and grew tremendously. And this is a table or a graph that taken from a report made by HIPAA, or made by the department who wrote HIPAA. And this is data that reported to the Congress, I think it was like around 2018 to 2022, right? This is the data governance that we had. Steve, we had a few discussions about this graph as well. Like the initial things that we can see is that individuals affected grew. We can see that the cost per breach remained the same, and we can see that the impacted organizations grew almost 3 times fold, like 2.5x. What else, or like, how can we interpret this data and use it in our favor when we're, like preparing for a budget, when we're preparing for that mission? Because attackers, they will still, work against us. And how can this be useful for a CISO, for a board member?
Yeah, I think that it's interesting information. I think it lacks some context, though. First off, the cost per breach, I think, is woefully underreported and miscalculated. And I know this is a little bit controversial to say because I don't enjoy just being a contrarian, but I do like to myth bust sometime. And for anyone who has been involved, especially with in the healthcare industry, and have worked on these problems, and I have many times, you realize that the level at which this disrupts operations, and most of what you see here, some of it is sort of leaky buckets, some of it is small problems, but a lot of this is sort of ransomware scenarios. And I can tell you that the loss of some recent breaches have caused some clinics to go bankrupt because they weren't able to collect sort of payments and transact with the way they needed to. And so the first is the cost per breach doesn't calculate a lot of necessary things. I think that there's also a human impact that we must think of, which it doesn't include that, right? So what's the cost for somebody who shows up and doesn't know what medicine they should have, or the doctor they should see, or the hospital doesn't have the chart for chemotherapy to know what the dosage amount is. These are all real examples. And taking organizations back to truly pencil and paper to figure out a way to literally operate their environment. So it's way more than this $10 million mark. The other thing is that we see this trend of, it centers around 600 and now 700. I think many in healthcare believe that it's just force majeure to kind of have these events happen, sort of like, hey, it's just an act of what's going to happen. And that should tell us that the things that we've been doing certainly are not enough, right? We've gotten used to failure, and they're often in a thankless role. Patient care is number one, and often things like technology comes last, and maybe for good reason in some organizations. And that's just the way it is. But we should be operating environments where we don't expect these kinds of things to happen because of how critical it is to have this, functioning hospitals and clinics. So I think that's the big thing, is it doesn't include some of what's most important. The numbers, I think, are underrepresented, and the volume. This is multiples a week that we hear about based on these numbers, and I think they've actually gone up in 2024. So interesting information. We're all sort of aware of it, but if you're using this in your board deck or your ELT or SLT deck, be careful, because as you know, it doesn't tell kind of the full story.
Yeah. And I think that, even diving into one case, as we're doing right now for a second, what would happen, why attackers were successful in those attacks, what was the damage, and again, like prepping around these kind of incidents, even running a tabletop or like drill that will allow our audience to get all the stakeholders aligned with the mission statement and the plan around there. That could be helpful even more than presenting the statistic. I'm totally agree. So we'll not get into like a full case here, but just as a reminder, one of the last known like big breaches or large breaches happened in 2023 when a prominent healthcare provider suffered from a very large data breach. And we knew that attackers accessed a very large database, that part of it was accessed online and protected online, with a lot of sensitive patient information that leaked and found its way to the wrong hands, and then was actually offered for sale. The breach was facilitated by compromised credentials that by the end of the day allowed unauthorized access. Well, this is the beginning of, I think, like Steve, what, 99.999% of the attacks that we heard about. It's less of the exploit, right? They used to say hackers do not exploit, they log in. It's that one credential that was lost, and then the attack journey or the kill chain started to work. So we see again identity at the front. We see that even if a compromised credential was used, the other stages, like security barricades or security controls that should have operated against those things, failed to detect that there's something bad with this user or machine that authenticated to our system. And it was just like a dry, probably implementation, if at all. And then we, the defenders, were not fast enough, or at least faster from the attackers, in order to stop that. And from there, the impact was huge. $10 million patient records were leaked with greater financial loss. I think that we should say no more about this kind of events. It's not just like to make us acting based on fear. It just that will be remember that it's not just the auditors that we're preparing to, right? They're the nice guys most of the times. We need to prepare to the ones that actually exploiting our slow implementation or the areas that we forgot to protect. And with that, let's move forward a little bit to ways to actually make sure that we're eliminating specifically the identity security gaps. We already spoke about adaptive risk aware MFA, right? Remember, guys, everywhere. It's a powerful tool if you're using it right. Proactive secure privileged access. Steve, you spoke about this a lot, and you gave the model of how to do that from tier 0 and forward. One of the things that I would suggest is that go through some of our other webinars regarding other identity threats that we're having there. The main point that we're speaking about is the ability to act in real time when authentication is happening, when system authorization is happening, when an identity, a user that might be legit or a malicious user, will try to authenticate and assume some entitlements in order to provide their legit or malicious act. Is this possible in healthcare systems or like in medical systems, Steve, like to be real time when it comes to security? Is it that, I don't know, like an inferior control?
Well, look, we know based on, let's forget about auditors for a second. Let's think a little bit about adversary behavior, whether it's out of a weak technical or administrative control. There's a case that recently did a review on where the adversary group, after they got a hold of the credential and had 2FA reset, it took them from that point in time an incredible amount of automation. So within 15 seconds of getting access, they had their device registered on the environment. And it was 3 minutes then to deploy their own server after that. So you have 15 seconds and 3 minutes from the time that they have access to a credential. So the need to do things in near real time, that's lost on a lot of people. You need something that is ideally in line. You need to think of the architecture of what it is, what you're using, and what it can tell you about these kinds of credentials and how your identity space interacts with your incident response space. And then how quickly from the time you say go, can you might have heard me say before, kind of as an old networking term, kind of source quench the environment or the identities or the assets around that. So we need people that can move quickly within these needs. It's not something that we can afford to have sent off to be processed and come back and maybe and have lack. The other thing that needs to be near real time, and this is a very real use case, whether it's from incident response, insider threat, credential misuse, abuse of privilege, is just the ability to terminate a session. And I know there's options. When you disable an account, it does not mean that the session, there's environments helping with breach response at a firewall level, at an access level, at a token level, at a Microsoft level, that disabling the account is not as permanent or as abrupt as you might think. And so that's part of near real time too. You need permanence and sort of an absolute view of when you say this is down, it's down. So that should be another sort of idea or requirement that you have when thinking about near real time. It's not only near real time analysis, but near real time response.
Yeah, I can cite a good friend of mine, a threat hunter, that once said that if you'll impose, it's the 80-20 rule, or like 20-80 rules. If you'll impose the right security logic for response, right? The if this, then what
Mhm.
on your environments, in 20% of, let's say, the top systems, the top like paths to your organizations, you'll stop most of the attacks right out of the bat, right? Regarding the 20, other percent of attacks, this is where we need to be super responsive, and we need to know how to control our security tools in order to be able to stop in time and not disrupt the business. And there's a lot to discuss about this thing, but I think that the answer is that if we implemented this right, we can respond in real. It's part of our plan. A lot of have been discussed about becoming holistic when it comes to visibility. And visibility is not just seeing everything in real time; it's being able to unfold the insights from tons of data that we're seeing there, and having a plan to respond or to make some changes based on the insights that we're getting, whether these are security posture issues, compliance issues, risks that's starting to increase based on misconfigurations or abnormal activity, and more than that. And the idea is that if we're not able to marry those insights with plans of actions, so we'll probably have a lot of bells and whistles. So when we're speaking about visibility, we're speaking about the right way to play with the data and to operate, our security efforts based on that. Inline access protection, we already discussed about, and aiming for identity resilience. Maybe this is the last point before we go to questions, Steve. When we're speaking about resilience, we've mentioned a little bit the ability to recover and restore. Can you give a little bit depth to that notion in the paper of HIPAA?
Yeah, so there's not they don't talk necessarily about this explicitly, but the idea that if there's a breach scenario, first off, understand what is being abused, what about your environment is being used against you. Sort of this concept of living off the land attacks. They're going to use your environment against you to have success. And so as you scope a breach, you'll have a remediation event. And that's effectively, after you figure out how far the adversary has gone, you'll have an event to throw them out, hopefully permanently. Identity is a core piece of this. And so I would expect that anybody who's working in identity there should be an identity analyst in the center of their response, figuring out a way to carve out which accounts are directly related. So then the response action will be many-fold. They're looking for persistence mechanisms, but one of them is the credential itself. Also things like droppers and malware, et cetera. But for the credential itself, you need to think of how you're going to box that in. We have a concept of identity firewall. So what accounts are acting up, and then how do I lock those down so they're no longer contributing to the success of the adversary? And then ultimately, how do I then rotate those so then they're known good and clean? Some organizations would delete an account. That can be controversial from a forensic standpoint, but how do I then return that credential, if it's necessary, back into use where the adversary has no use of it, right? So how do I begin to limit use, and ultimately then reflect on my environment to think, what can I do? You think of zero trust. How can I limit access so I have these important credentials? How do I take the most important ones and limit specifically on certain ports or devices and access? So then now I'm going to carve my environment up, not just by firewalls, the old style, but also how do I carve up my important identities to limit them to the access plane that they only need, and to do that within software and from a monitoring standpoint. So all of those ideas need to be in mind if you really care about this. That's what leading organizations are spending their time thinking about.
Yeah, I totally agree, and I think that we need to remember that restore of a compromised identity or credential is important, but we need to make sure that our systems are not poisoned. Even the backup systems, or that we're restoring to a point that the attacker will not be able to leverage on, right?
Yeah.
Times that it didn't have access to credentials that are not in use, areas like that. Sometimes we're forgetting that, and I'm saying yes, like we can recover fairly quickly. That will be fine. And the second point is that we need to remember that resiliency is the ability to keep like the lowest downtime due to the attack in general, and the highest trust that we can have in other parts of the system as well. So exactly like you said, we can limit the identity, we can limit the actor, we can slow down some of the things, we can limit the access, but by the end of the day, the business must go on, the show must go on, and we don't want to give those attackers the ability to sabotage our business flow or our availability. So I think that we got out just right to the point of closing marks and Q&A. So without repeating ourselves, we'll just we hope that you've enjoyed this webinar, and there's a lot to be shared about this topic. It's an ongoing effort of some organizations to make sure that we'll be protected. Share this webinar with your team. Right after this session, we'll share the recordings. You can go to our website and silverfort.com and download the script and get access to the webinar. Start your plan today. If you can, even mentally, be prepared to play those scenarios. Okay, what will happen when I'll start to implement this? What will be required? How do I start to think about budget? How other departments will be impacted based on those requirements, just in order to be with the upper hand when those regulations or updates will be posted. If you'll remember one thing from this webinar, as again, two longtime players in the space, Steve and I found that identity-related work is one of the most important things that these changes offers. Identity becomes central in hybrid systems. Human and machine identities are the point of controls of your systems. A lot of the changes are focused on identity, even if not mentioning this specifically. Go to your IAM team, okay? Be a friend with them. Make sure that you're able to answer the very basic questions about who can access what, where, how, internals, externals, what security controls are already available that you can play with. And get acquainted, with other vendors that can offer your work of implementation to be much more easier. And of course, stay tuned to a lot of other content that we'll publish. We have 2-3 minutes for a few questions. Like I saw dozens on the chat. Bob, I'll let you decide which ones, although I can categorize them, right, or group them to 2 or 3 areas. So.
Yeah, no worries. And great job, guys. We are up against it, so we just can answer a few questions today. But like I said, if we don't get to yours, we will follow up after the webinar via email. But so for the first one, do we see an emerging relationship between incident response and identity?
Steve, do you want to take this one?
Yeah, no, I think that there's absolutely a relationship between the two, and it didn't always used to be the case. I can tell you that, most of the big problems I've worked on are centered around identity as it relates to incidents and breaches. But for a long time, those two teams kind of worked separately. So the relationship is growing, and it needs to be something from a leadership perspective that we think of. I honestly think there should be a rotation between identity staff and SOC staff, and the responders and incident responders in an organization, if they're large enough to allow that. The key ingredient in much of this, the problems that we have is sourced from identity, weaknesses within it, and not monitoring, kind of the behavior. Behaviors become big in the SOC space, right? UABA, looking at the behaviors of individuals, deviations from the norm, right? So all these elements of machine learning and creations, AI now, agentic AI, all of this is related, and so we need to think more about the privileged access lifecycle and the behavior of these credentials, just like we would any other analytic group. And so you're seeing, incident response and analytic processes that are built that aren't siloed but shared between, whether it's an incident or a breach scenario. So it's, again, organizations are growing and changing. More emphasis is being placed on the identity, and for good reason, right? So absolutely there's a tie there, and there ought to be a connection between the two. That's your response workflows, that's your training, that's the points of visibility, and those organizations, you should also look for opportunities to co-fund and to sort of share budget on this space, because of the needs around incident response and cleanup and risk reduction.
Bob,
Okay, great.
what's the next question?
Yeah, so we'll just do one more. So the question is, how can we ensure continuous monitoring and improvement of our security posture to stay compliant with the updated HIPAA guidelines?
I think that there's like a couple of angles to that. I'll take a few, and Steve, please feel free to add or challenge mine. I think that the first thing is the ability to see everything in a unified way. There's a lot of pieces of data. There's a lot of real-time systems. The access journey is complex. It's not just going through one or two tools. Sometimes we're speaking about 5, 6 nodes along the way with different departments responsible for the network, the software, the security controls or identity, the databases and others. So being able to work in a unified way, bring everything to one single place, and then having your governance rules implemented on those systems, right, or the filters to see what actually the posture is of per identity, per different focal points or systems. This is the first thing that I would suggest. It's not an easy work, but today we have a few vendors that actually allow this to be happening, and then you can play with your own framework and others. The second thing is exactly implementing the risk review or the risk assessment that we spoke about. Don't just speak about posture and don't just speak about compliance. Try to have your own risk model. Try to have your own risk scoring to the areas of posture. Think about risk as a tool for creating the sense of urgency, and make sure that the top two, let's say risk number 5 is the top. So 4 and it will be high, 5 will be critical, that you have a plan or how to run the change management in order to actually reduce those risks immediately. If you're having too many criticals, too many highs, you're aiming wrong. And the third thing is being able to communicate the value and those systematic changes that we're having in terms of security to the other stakeholders that will be part of your journey. And this is how you can be not only real time, you can speak with the value, you can speak with the risk, you can speak about the efforts at the same time. So these are my 2 cents. Steve, anything to add?
Yeah, I mean, to continue on, I would break it tactically into kind of 4 buckets, and I might report on it as a measure of maturity in a couple different ways. So one is, what am I able to onboard, and how fast can I onboard the credentials that I need? So that's a measure of maturity, right? So how many can I, and how quickly can I? Do I have the ability to understand gaps in my environment? So do I even know what I don't know related to identity? Do I have a way to fan out and figure out what may be a gap? And that in and of itself is a measure of maturity around continuous monitoring and your posture. And then I would want to see something like, how trivial might it be in my environment to bypass something like PAM So do I have, are there situations where I have accounts that aren't protected? Things are in new PIN mode. I don't have a step up available. And what creative way could an adversary maybe get access or go into, like I said, new PIN mode? And then the other is, how do I monitor, how good am I at monitoring, privilege abuse, privilege access abuse in my environment? So do I have a way to report on that? How quickly can I create it? And then what is that trend over time, right? So how does that relate to things like, as an example, we found that organizations that don't onboard well have a higher likelihood of having dangerous scenarios around credentials and user behavior, right? And 1% create about 50% of the noise, right? So if you don't onboard and educate well, that affects things like your access and your employee behavior. The other thing that's kind of outside of the technology, the happier your employees are, the fewer incidents you have. If you have people that are grumpy, there's a measurable increase in the number of incidents centered around credentials, right? Depending on what you read, 80% or more, whether it's initial access or the breach itself, it's all tied around credentials, right? So, think about it around those four and then understand maybe those, how it all plays in. What's the big picture with this? Would be my sort of advice around continuous monitoring and then improvement over time.
Okay, great. Unfortunately, we are up against the time now, but Roy and Steve, this was a great presentation. I thank you for your time and for all of you who were able to join us today on behalf of Silverfort. We thank you. Please visit our site to, keep up with the latest and greatest in identity security, and feel free to reach out to our experts with any questions. Thank you all again.
Thank you.